So a cleft lip or a cleft palate is a congenital deformity that develops when a baby is in a mother's womb, where the lip and the palate doesn't come together, the mouth. So the cleft lip only affects the lip. It can be on one side or bilateral, which is both sides. The cleft palate is actually on the inside of the mouth, where the roof of the mouth is not correctly formed and forms a bit of a cavity. Some children unfortunately have both, which means we would have to repair the cleft lip first, wait for that to heal, and then in the future, maybe 6 to 8 months, we can come back and repair their palate as well. And it can lead to some difficulties when the children are growing up. They cannot feed properly, and if a child does not feed before the age of 2, they may grow up to be malnutritioned and stunted in growth. It can also mean that they cannot learn to speak or communicate with their family and friends. This week we've had a visit from a Korean surgeon named Dr. Han, who's come here to perform cleft lip and cleft palate surgery on the children in Luang, Prabang and surrounding provinces. They are loosely connected with the YMCA and another group out of Thailand, Chiang. Transforming Faces is the group. They've all come together and decided to come and help here at LFHC. We have managed to do 2 cases a day this trip, and we plan to expand next trip, maybe in May next year, where we will do probably double the amount of cases that we've done this time. Dr. Han worked very well with our team here despite the language difficulties. In theatre today we were speaking Korean, English, Khmer, Lao and Hmong. But everyone got along and we did really, really well. So the families of the patients have come from here in town and from as far away as 8 or 9 hours. These are patients who've presented at the hospital over the past year and a half. We haven't been able to do this operation before until Mr. Han has come to help train the doctors. This is the first time we've had a visiting surgeon here, and we weren't really sure how our nurses and I would be able to deal with them. But Dr. Han has turned out to be a very, very polite man, very easy to work with. And the team came together very, very quickly. And from the first operation we did on Monday to now, which is the Thursday, we've improved every time. It's been a big success, I think. And if the families manage to look after the child's wound the best way possible, the scarring will be minimal. Almost, you won't be able to even know that they ever had a cleft lip. The cleft palate is a bit hidden away. This is the first trip of what should be a regular, every 6 to 8 months, Dr. Han plans to come back and bring different support team, speech therapists, nutritionists. It'll be an ongoing collaboration between us and the other charities that will help the children of Luang Prabang.